This is Stockholm, Sweden, as of just a few days ago, December 4th, 2020. And do you notice anything interesting about this footage, ladies and gentlemen? Well, I certainly did. As I scroll through, I have yet to find one single person wearing a mask. We don't see any social distancing. We see a lot of people walking around freely, enjoying themselves, engaging in commerce, walking around without a muzzle. This is incredible. I feel like this place is suspended in like the fall of 2018 or something. It's like a magical place today. Well, why is that? Well, we're going to look at that in this video. Sweden says no need for face masks as COVID-19 deaths top 7,000. Meanwhile, on our own soil here, vaccines are coming this month as Ontario hits new daily records and PEI locks down. Why are they doing that, guys? Well, they've just reported 4 new cases of COVID-19, which is enough for them to want to institute this circuit breaker lockdown. We're going to explain exactly what that means. Meanwhile, BC extends its ban on social gatherings until January 8th, restricting Christmas and New Year's Eve events. BC health officials have extended a widespread ban on social gatherings with anyone outside of one's immediate household through the holiday season until midnight of January 8th, meaning you cannot have family members over for Christmas if they don't live in your immediate household. So we're going to cover all of this and much, much more in this video, guys, so stick with us. But before we do, I'd ask that you check us out here on subscribestar.com/pressfortruth. Here you can sign up for a monthly reoccurring contribution, $5 a month, $10, $20, $50. Any amount helps when it comes to helping this channel survive in this age of censorship, and as they're trying to just financially attack me here moving forward. With your help, guys, that won't be an issue. Subscribestar.com/pressfortruth. Links are located in the description below. All right, let's take a look at what's happening here in Sweden. I gotta say, is this not a nice sight to see? Does this not give you a sense of just relief? And my God, wouldn't it be nice to be there right about now? Again, let's take a look into the mentality of the Swedes today. Sweden has not needed face masks yet, a top health official said on Thursday, as deaths from the pandemic climbed above 7,000, and a day after the World Health Organization expanded recommendations for when face masks should be used. The WHO said on Wednesday that where the epidemic was spreading, people, including children and students aged 12 or over, should always wear masks in shops, workplaces, and schools that lack adequate ventilation, and when receiving visitors at homes in poorly ventilated rooms. However, the Swedish Health Agency, largely behind Sweden's no lockdown strategy, has refrained from recommending masks, citing poor evidence of their effectiveness, and fears that masks may be used as an excuse to not isolate when experiencing symptoms. Face masks may be needed in some situations. Those situations have not arisen in Sweden yet. According to our dialogue with the healthcare regions, Andres Tagnow, Sweden's chief epidemiologist, told a news conference on Thursday, WHO is clear that the state of evidence for masks is weak. All studies so far suggest that it is much more important to keep your distance than to have a face mask on, he said. In a bid to stem a severe second wave, Prime Minister Stefan Löfven announced on Thursday that high schools would switch to distance learning for the rest of the year. Sweden registered 35 new COVID-related deaths on Thursday, taking the total to 7,000. The country has registered 6,485 new coronavirus cases on Thursday. That compared with a high of 7,240 daily cases recorded 2 weeks ago. Here's the thing. Sweden's death rate per capita is several times higher than that of its Nordic neighbors, but lower than several European countries that opted for lockdowns. Do you see what that means, guys? The Swedes are basically just as fair off as most countries. They're doing very similar to a lot of places, yet they didn't lock down. They are not muzzling their population. They are not completely destroying the economy, and the numbers are staying relatively the same. That should tell you something, ladies and gentlemen, and this should tell you something too. PEI reports 4 new cases of COVID-19. That got them to shut the entire thing down. This is absolute ludicrousy, madness. Prince Edward Island reported 4 new cases of COVID-19 on Monday, bringing the number of active cases on the island to 14. Dr. Heather Morrison, PEI's Chief Medical Officer of Health, announced the new cases during a new update on Monday. Here we go. Monday's new cases involve 2 males in their 20s, a male in his 30s, and a female in her 20s. All were close contacts of the cases previously reported over the weekend. This is really important to understand, guys, and that's why we have to understand the language, the terminology. I've already pointed this out in other videos, but it needs to be done again. We have to drive this info home to the masses. This is from the CDC, cdc.gov. What is a COVID-19 case? Yes, let's understand the data. What is a case? A COVID case includes confirmed and probable cases of death. Well, why don't we go to the Ontario Health government's site to get a definition of what a probable case is, which we were just told by the CDC is counted. We see here a person who has not had a laboratory test with symptoms compatible with COVID-19, or, look at this one, section B, close contact with a confirmed case of COVID-19. Someone who has had close contact is a probable case. Those cases are counted in the numbers. Guys, this is just contract tracing stuff. These 20-year-olds and 30-year-olds have not been tested. We don't know if they're necessarily positive or negative, but they still counted it in the numbers as being a case number. This is absolute ludicrousy, and this is what caused them to institute a circuit breaker lockdown. And we're going to talk about exactly what that implies. But before we do, I'd point you to this tweet that I put out, what was this, yesterday, or a couple days ago now. Warning, mega alert. Did you hear about the cases? They're up. Cases have been climbing. Cases are up. Cases. There are cases and more cases. Did you not see the cases? Breaking. Cases, cases, cases. Won't somebody think of the cases? Obviously, I'm making the point here that the media is pushing this idea of cases being the thing you need to fear, when the real thing you need to pay attention to is the death numbers moving forward, guys. So let's just not forget that. Now, let's take a look at what these cases have caused in places like PEI, circuit breaker lockdown. What does that mean? Well, the new health protocols will remain in place until at least December 21st, yeah, right, and include closing all dining rooms and restaurants, fitness facilities, bingo halls, and libraries. Organized gatherings will be limited to no more than 10 people, and retail stores must limit capacity to 50%. Again, this is based on a couple of cases. 4 Island high schools, Charlottetown, Rural, all these schools here have moved to online learning this week. All PEI's school sports and extracurricular activities have been temporarily suspended. Again, making absolutely no sense as I understand it. I don't think anybody under the age of 45 has died in Canada as a result of contracting this disease. So why people are muzzling their children is beyond me. A hospital and care facilities across the island will be limiting their visitors as of Monday. Only one designated partner in care will be allowed to visit patients and residents at hospitals and long-term care facilities and other facilities on the island. Patients and residents of hospitals, long-term care facilities, or any other care facilities may designate one partner in care, a family member or a friend who helps provide additional care for the patient or the resident. No other visitors will be allowed, except for compassionate circumstances, such as when a patient is nearing the end of their life or when special permission may be granted by Health PEI. This is just absolutely brutal that they would be able to do this, guys. I had a friend whose father recently died in the midst of all of this, and he had many kids. So there were more than 10 in the immediate family with brothers and sisters, and you know, did they have to decide who gets to go to the father's funeral? It's absolutely insane. But it gets even crazier here in BC because there's that plus more. Get a load of this, guys. On Monday, Provincial Health Officer Dr. Bonnie Henry also extended the requirements to wear masks in indoor public spaces and the ban on adult indoor and outdoor team sports until the same date. This means British Columbians will not be able to get together with anyone they don't already live with. Not in parks, backyards, or restaurants to celebrate the holidays. You can't even stand around out in open nature with your family during Christmas. Drive-through holiday events that allow people to stay in their vehicles with members of their household can proceed. Events such as drive-in movies have a capacity of 50 vehicles. Because that makes a lot of sense, right? You can have drive-ins only if there's 50 vehicles. So you can't have 51, you can't have 75, you can't have 100 people gathering in their cars, can't have 200, but you can have 50. The virus is pretty smart. It knows that once there's more than 50, it can just start jumping and traveling through metal and glass. So the moment they break that 50 number, it becomes dangerous. Where do they come up with these? Is there any science behind the reason why only 50 people are allowed to gather isolated in their cars? Guys, this is just absolute lunacy. I hope you're seeing it for what it truly is. All other holiday events are canceled, Henry said. The restrictions around in-person religious services also remain in place, including on holiday-based gatherings such as mass, weddings, baptisms, funerals. They're all still allowed to take place with a maximum of 10 people. But any gatherings before or after, such as receptions, are still off limit. Can you imagine having your wedding and only being allowed 10 people? Or a funeral only being allowed 10 people? All based on the fear state that the health officials are creating around these numbers, these daily reading of the numbers, just ramping up the fear state here and now taking away your ability to engage with your family. You know, this is truly an attack on the family unit that we're seeing. They're just trying to destroy the family unit slowly but surely. All British Columbians are still being asked to avoid non-essential travel. Loved ones traveling from home to work or post-secondary education are urged to immediately enter and stay in their household bubble and follow the provincial orders. Since the sweeping measures were put in place across BC on November 19th, there's not been a significant drop in the number of cases, Henry said. Oh, right. So that makes perfect sense why we should extend it. It's not even working. Case numbers keep going up. So, oh yeah, no, we better extend it. On November 19th, 217 people were in hospital with the disease. On Monday, there were 349 people in the hospital. Yeah, they're not telling you what that actually constitutes and what that means, the context behind that. Let's face it, as I reported in a video not long ago, CTV accidentally revealed the real death counts. As they said, 10,000 something people have died, and then they mentioned that there was only 10,000 and something of those who died in long care term facilities. You know, you quickly do the math, you figure out that as of November 15th, 2020, only 166 people in all of Canada has died as a result of COVID-19 outside of long-term care homes. 166 people, guys. No one under the age of 45. Most of them over the age of 70 and in long-care care facilities. 99.9% survival rate. Yet total lockdown, total shutdown, total control. Henry had banned all social gatherings with anyone other than one's immediate household, as well as indoor group physical activities in the Lower Mainland. That was back on November 7th, amid a surge in cases. She also ordered all workplaces to conduct active in-person screenings. Now look at the pattern here. From November 7th, on November 19th, she extended the ban on social gatherings to December 7th. Remember that? And now we're here at December 7th, and they're extending it to January 8th. I hope you see a pattern here, guys. I hope you realize this ain't going away on January 8th. They say it's extended until January 8th at midnight. Mark my words today, folks. Guess what's going to happen on either January 7th or January 8th in the morning? They're going to extend it to mid-February. You see, if they put these lockdowns and restrictions on you saying it's indefinite, people would be freaking out. But if it's just, only 2 weeks to flatten the curve, well, I can put up with that. Remember how 2 weeks slowly turned into a month and then a few months, and here we are going nearly on a whole year? Guys, this isn't going to slow down anytime soon. It's more important now than ever that we take the freedom and individual liberties that we have into our own responsibility. We can't rely on the government anymore. Can't rely on the banks. We never should have. Can't rely on the grocery stores. We have to become self-sustainable moving forward. And that is going to be my most important message for all these videos. If you don't know how to grow your own food today, you really need to start learning and start focusing on getting yourself out of debt and being able to homestead completely self-sustainably. We'll finish this up. Last week, Henry banned all outdoor and indoor sports teams, though kids' dance classes are still allowed, over concerns that people were carpooling to games together or gathering socially before, after, or even during play. Churches and other religious spaces can still be used for childcare and self-help meetings. The newly extended orders will not impact hair salons and restaurants, Henry added, but customers can only visit with people in their immediate households. And here they give the daily numbers once again, confirmed 426,000, deaths 12,000. Again, like 98% of those are in long-term care home facilities. And of course, any death is troubling. But they're not telling you that these people are not dying of COVID. They're often dying with COVID, with many other comorbidities, cancers, many other underlying health issues that were the real cause for their death. Meanwhile, it's chalked up to a COVID death. These are the facts. This is the truth. This is not what you're getting from the mainstream media. This is why so many are running around scared to death for no good reason. Guys, let's take an example from Sweden and recognize that there's no need for the face masks and the lockdowns. The numbers are remaining relatively the same as other places here. And that should tell you that this is indeed all about control, and it has nothing to do with your health. Guys, please share this video if you found the information to be useful. Don't forget to check me out here on subscribestar.com/pressfortruth. You can sign up for a monthly amount, a reoccurring monthly amount. Any amount helps. Once again, if you appreciate me bringing you this information to the table, please check the links in the description below to find out how you can financially support my efforts. And if you are not able to do that, that's fine. The best thing you can do at this stage in the game is to share this information. Click this thumbs up button and get the word out, guys, that COVID-19 is not that bad. Thanks for watching, guys. Once again, click that thumbs up button. Stay tuned for more videos coming soon. This is Dan Dicks reporting for Press for Truth. We all want truth. The truth will set you free.